Alright, so first we're going to talk about what SIDS is, or otherwise known as Sudden Infant Death Syndrome. SIDS is defined by up-to-date as the sudden death of an infant younger than 1 year of age that remains unexplained even after a thorough case investigation. It lies under the category of an unexplained, sudden, unexpected infant death, which also holds other cases not considered SIDS, but lacking in a clear explanation due to uncertain circumstances. Also, according to UpToDate, the most likely theory is that infants who die of SIDS have an underlying vulnerability, such as genetics, and are exposed to a trigger, such as unsafe sleeping, infection, stress, or maternal smoking, at an early stage in their development of their brain or immune systems. It is deemed a necessity to have a careful death scene investigation and an autopsy within 24 hours, and also a review of clinical history when diagnosing SIDS cases versus other causes. In the death scene investigation, there should be observations made by emergency responders as to the position of the infant, marks on the body, body temperature and rigor, type of bed or crib and any defects, the amount and position of clothing and bedding, room temperature, type of ventilation, heating, and the reactions of the caregivers. In the autopsy, they can look for congenital abnormalities, injuries, infections, or metabolic defects that can't be seen by the naked eye to discover a possible cause of death. A known cause of death is identified in approximately 15% of suspected SIDS cases, even when the clinical history and death circumstances appear as. To quote UpToDate, external findings consistent with SIDS include a well-developed, well-nourished child with frothy, blood-tinged fluid at the nares. Internal findings include intrathoracic petechiae, pulmonary congestion and edema, upper respiratory tract inflammation, and hepatic hematopoiesis. So now I'm going to talk about one of the biggest misconceptions, which is that vaccines cause SIDS. But vaccines do not cause SIDS. There is no evidence that vaccines increase the risk of SIDS, even though reports have been made that infants have died within a few days or weeks of being vaccinated. But that is because most kids in the age range for SIDS are also getting their first vaccinations. SIDS has fallen since the 1980s, whereas the number of vaccines administered continues to rise. Alright, on this slide you can see that some risk factors that have been determined for SIDS follow closely with that of sleep-related infant deaths. Those risk factors include prone sleeping position, maternal smoking during pregnancy, preterm birth and/or low birth weight, sleeping on a soft surface and/or with loose soft objects such as pillows or stuffed animals, bed sharing, young maternal age, late or no prenatal care, overheating, and a lack of breastfeeding.
Now that we've learned what SIDS is, it's important to understand that there is truly nothing that can predict whether or not a child will die from SIDS. However, there are strategies that caregivers can take in order to lessen the risk. According to UpToDate, during pregnancy, women can reduce the risk of an infant getting SIDS by attending prenatal care appointments and avoiding smoking during pregnancy. Though there is very little that one can do during pregnancy, both of these factors are key in providing the best care for the fetus. After the child is born, there are many prevention methods that caregivers can implement in order to reduce the child's risk of SIDS. According to UpToDate, these include categories such as where and how the infant should sleep, parents not smoking, and breastfeeding infants after birth. The first of these categories is where and how the infant should sleep. Infants should always be placed on their backs to sleep. The AAP's 1992 Back to Sleep campaign proved that the SIDS rate dropped over 50% after informing parents of the importance of back sleeping. This means that children should never be placed on their sides or their stomachs in order to sleep. The second of these is that infants should never share a bed. This is with a parent, caregiver, or any other child during the first 6 months of life. This also includes any couches, recliners, chairs, because of the possibility of rolling into cushioned spaces. Finally, infants should be placed on a firm sleep surface with no soft objects in the sleep space. Never place infants on cushy surfaces or air mattresses to sleep on. This also includes blankets or cradle bumpers inside a baby's crib because of the risk of suffocation. Children should also never routinely be placed in car seats in order to sleep because they do not breathe well when sitting in the upright position. Car seats are still strongly recommended for car travel, however, it's not recommended to use these outside of car travel.
So we chose to do an interview with Cindy Clark, who is a registered nurse, She has a background in labor and delivery, mother and child, and pediatric nursing. So my job was to interview her about the importance of education and prevention of SIDS. So the first thing she talked about was postpartum education. And we want to try and teach safe sleep habits to both mom and dad, just because baby won't be sleeping with just one parent. And it goes for all of the family as well, especially if grandma and grandpa are around or any other family and friends who are helping. So Cindy said a baby who is at a risk factor for SIDS is a baby who sleeps with too many blankets on too soft of a surface. So while we're in the room with mom and dad, we want to model and teach baby to sleep on their back. And we also strongly discourage co-sleeping, which families really try and fight, as they believe that it's going to help with the bonding and nurturing to the baby, which is true. You want to create that bond, but we don't want to put baby at risk for possibly having SIDS happen. With nursing in the hospital, we also want to have a safe sleep hospital. So those are hospitals who put plans into the labor and delivery process to help moms and dads learn about safe sleeping. So with that, an example of a safe sleep hospital crib is a crib that there's nothing in it. There's nothing in the crib like blankets or pillows. We put baby in a onesie or in a zip bag, which kind of keeps baby all snug and close together like in a sleeping bag. And so there's no chance of getting caught up in blankets and suffocate. When talking to Cindy about potentially at-risk families, parents who smoke are a large risk factor, along with parents who co-sleep. And we briefly touched on that a little bit, but the main thing is parents really want to try and co-sleep, as I think, again, that it would help nurture and build a bond, but it's a huge risk factor, and more often than not, it ends in a really sad situation. Another risk factor is babies who are born prematurely, and babies who have mamas who smoke throughout the pregnancy are at risk for SIDS. I asked Cindy if adolescent mothers are potentially at a higher risk for their babies having SIDS, and Cindy said that it depends on the home situation. Typically, if they have a really supportive home situation where parents are involved, guardians are involved, whoever is there to support her, she's going to be able to be taught the correct ways for her child to go to bed, along with everybody else who is involved with her. If there's not a lot of support around her, or they're in a poor economic situation, that is a large risk factor due to possible neglect of the baby and lack of education for the parents and the families surrounding her. Cindy also touched on programs that hospitals can have to help families who are in poor social economic situations. And as nurses, we should try to encourage these programs to help families who do not have financial resources to provide baby and mother with a safe and positive living environment. Having a safe space for baby to sleep is the most important part of this, and for example, there are hospitals who put kits together for families to go home, and they have just as simple as a cardboard box for baby to sleep in with nothing in there. It's just that, and it's a clean space for baby to be at. And that sounds super simple, but it's also very important that baby has that area to themselves.
Now that we know what SIDS is and how to prevent it, let's talk a little bit about how the nurse should respond if SIDS does occur. So according to Sudden Unexpected Infant Death, including SIDS Initial Management from Up to Date, if a nurse is present when an infant is discovered dead or unresponsive, or if the infant is brought to the hospital unresponsive, resuscitative efforts should immediately be initiated as is appropriate for the situation. Important information to gather, if possible, includes when the child was last seen alive and responsive, who found them, which position they were sleeping in, and any recent changes in either the environment or illnesses that they were exposed to. If the infant is unable to be revived, the family should be able to see, hold, and touch their child if they wish. They should also be allowed to perform any other actions that they need to express in order to express their feelings or cultural practices. According to Grief and Bereavement in Adults from Up to Date, at the death of a child, there is a wide range of reactions that the family may experience and express. These can range from numbness to hysteria and include screaming, crying, and collapsing, or no expression of emotion at all. The family should be provided with a private space and allowed to grieve in private and be with the child's body if they wish. Spiritual leaders, social services, or other family members should be informed by the hospital staff of what has occurred if it is requested by the family. Physical reminders of the child may be useful, and they can include a lock of hair, a hospital bracelet, or hand and footprints. They can be comforting to the family and can be prepared and given to them if required. If an autopsy is being performed, it should be explained to the family what will happen during the autopsy, and it should also be explained why one is done and that it is done in a respectful manner. When leaving the hospital, transportation should be either provided or arranged so that the family is not driving themselves home. It is also important that information is provided regarding how to make funeral arrangements, as well as a hospital contact number in case they need further resources or have further questions. The family at this time is extremely fragile and should be allowed to process their grief at their own pace without being rushed. Providing resources that can aid in grief management, such as information on support groups or counseling, can be very helpful for patients after the initial shock. The National Center for Education in Maternal and Child Health is a good resource for education about SIDS and has some information on support groups as well. And First Candle, which is a national network of SIDS support groups, can be another great resource to make available to friends and family. Grief is a natural reaction to the loss of something dear to us, and a patient should be allowed to work through their grief at their own pace. The nurse's role in helping a patient who is grieving is to be supportive and to listen to and address the person's concerns. While acute grief typically does not require medical help or treatment, patients may seek relief from symptoms of grief. These can include insomnia or intense sadness. Grief can also aggravate or trigger suicidal thoughts and behavior, depression, PTSD, insomnia, and anxiety. A patient should be assessed for these conditions and for suicidal ideation. The patient should also be encouraged to seek support from friends, family, and religious figures in order to manage their grief, as this has been proven to be one of the most helpful components in grief management.
SIDS is the leading cause of death for infants in the United States between 1 month and 1 year of age. But how often does it actually happen? SIDS occurs in approximately 1 in 1,000 births in the U.S. The Back to Sleep campaign has reduced the incidence of SIDS by over 50% in the past 30 years, especially since the 90s. This chart from the CDC shows SIDS cases by year since before the Back to Sleep campaign went into effect. So it starts in 1980, and it shows that the rate has decreased from 153 deaths per 100,000 births in 1980 to 51.6 deaths per 100,000 births in 2010. You can see there's a large decrease in deaths in the early 90s when the Back to Sleep campaign went into effect. The rate has slightly decreased since 2010, although it's not seen on this chart. Causes of SIDS are also changing. In the 90s, most SIDS cases were due to sleeping on the stomach, and now most SIDS cases are due to accidental asphyxiation or an unknown cause. SIDS can happen anytime within the first year of life, but approximately 4% of cases happen within the first week of life, and 12% happen within the first 28 days, also known as the newborn period of life. According to data from the National Institute of Child Health and Human Development, the median age for SIDS death is 11 weeks, and 90% of cases occur before 6 months of age. SIDS affects a range of different types of families and infants across socioeconomic and cultural lines, but there are some trends. The first of these is siblings of SIDS victims, who are most likely to also experience SIDS. According to Dr. Michael Corwin for Up to Date, siblings of SIDS victims have a 5 to 6-fold increased risk of dying of SIDS, and twin siblings have a 2-fold increased risk of SIDS. However, the risk that a second child will die as a result of SIDS remains less than 1% for most families. Losing multiple children to SIDS is incredibly devastating to families. Another trend is found in ethnic and gender backgrounds. According to Dr. Corwin, rates for SIDS death of African American and American Indian infants are 2 to 3 times the national average. This chart from the CDC shows the rates of SIDS by ethnicity in the U.S., obviously with American Indian, Alaskan Native at the highest, and Asian or Pacific Islander with the lowest rates.
Thank you for watching our video, and I hope that you've learned some valuable lessons that you can incorporate into your nursing career in the future.